Well, you probably know if you go out of your insurance network for health care, your company may not cover the cost.
A local woman says she was shocked to get this huge medical bill, even though she stayed in her network. She turned to Local 12 troubleshooter Howard Ain, who has her story, plus important tips for the rest of us.
When Kelly Hoefler of Batavia needed to see a medical specialist, she says she was careful to find one who was in her medical insurance network. She saw the doctor and everything was fine till several months later.
And ended up something had to go to a lab. Well, I assumed in-network doctor would send it to an in-network lab, but this wasn't the case.
As a result, she received a large bill from the lab.
I contacted the insurance company and they said, well, you let it go to an out-of-network lab, so they don't, the insurance company, will not pay. I called the doctor's office and they said, not my problem.
The lab received nothing from Hoefler's insurance company, so wants her to pay $266.
That could have been avoided if I had known where it was sent or given the option of it, going elsewhere that could send it to an in-network lab.
So I contacted her insurance company about this bill. A spokesman agreed to look into it and later called Hoefler to say the company would pay the bill as a courtesy.
I am totally relieved.
Were you surprised to get that call?
I was surprised. I've never, heard of such a thing as a one-time courtesy, and I had gone in a circle and a dead end for so long.
Hoefler says she knows she's not the only one this has happened to. She talked to one woman who said her husband had a bill for over $300 that he ended up paying. As a result, she has this advice for everyone.
When you go to the doctor, get details, and it should, if he does have to go to the lab, make sure it's covered by your insurance.
A spokesman for Hoefler's insurance company tells me the company tries to educate its doctors to keep patients within their network. Yet he agrees Hoefler's tip is a good one. If your doctor sends out any tests for you, make sure they go to in-network providers. If you get a bill like this from an out-of-network provider, immediately contact your insurance company to complain, because doctors are supposed to keep patients within their network. Howard Ain, Local 12 Troubleshooter.